Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanutu on Facebook and YouTube every Saturday at 4 p.m. on the online pregnancy school as she discusses pregnancy, delivery, and childcare.
Hello, dear viewers and listeners. Welcome to your favorite program, the online pregnancy school. You know, life is such that there's a lot to be learned. Every day there's something new to be learned. And that is why if you don't avail yourself to have knowledge, you might be left behind. My name is Dr. Linda Vanutu, and this is the online pregnancy school. We have said a lot about fertility, reproduction, and pregnancy, and we are learning. So get your paper, get your pen, and join us. Today we're going to have a very important discussion on another aspect of pregnancy that is key to the survival of every pregnant woman. Let's go for a short break. Yes, so welcome back. As I said, we're going to have a very important discussion today, and it is about bleeding in pregnancy. You know, pregnancy should be a time of joy and not of anxiety or fear. And that is why we are bringing you all these discussions so that you would learn about pregnancy, whether you are pregnant or not, whether you are married or not married, and especially if you are pregnant. Today, it's a pleasure for me to introduce my guest. And my guest to join me in this discussion is a colleague, a friend, a doctor, a female. She is Dr. Sylvia Diganus. Dr. Diganus is a consultant obstetrician gynecologist. Now you know what that means. But if we add consultant, it means that that person has gone very far in the care of women. And that is why we are going to discuss this very important topic. Dr. Sylvia Diganus, you are most welcome to the online pregnancy school.
Thank you very much, Linda. It's a pleasure to be here.
How are you?
I'm doing good.
So today we're going to talk about bleeding in pregnancy. Our topic is on PPH or postpartum hemorrhage. And I know you're going to break it down for the general public to understand what it means. But before we get into the PPH, do we have other types of bleeding in pregnancy before the women deliver?
Yes, we sometimes have bleeding during pregnancy. Of course, we can look at early pregnancy. And when we are talking about early pregnancy, the first half of pregnancy from maybe 1 month till about 5 months or so, you can talk about bleeding during that phase, which we normally relate to miscarriage or a tendency for miscarriage. That is bleeding in early pregnancy. We can also talk about bleeding in late pregnancy, especially in the latter half of pregnancy from 7 months to 9 months. And that is what we call antepartum hemorrhage or bleeding before delivery. Okay. The causes obviously are different for each one, but every bleeding is dangerous. The one I want to mention that is not often seen, but is also bleeding is ectopic pregnancy, okay, where you have bleeding into the abdomen. So that one, you are bleeding, but it's pouring into the abdomen, the space in the abdomen, and you cannot, or in the stomach and you cannot see it externally. So these are all different types of bleeding. But the ones we see flowing outside are the ones that are related to miscarriage. And then the other one, which is in the late part of pregnancy, which normally has to do with problems of where the placenta is located, or maybe the placenta is separating. They all have different names.
Okay.
So these are the different types of bleeding.
Wow. The complications associated with this bleeding, the bleeding before a woman delivers, are there complications?
Yes, obviously there are complications. And like I said, that kind of bleeding normally, which we call antepartum hemorrhage, or bleeding before you deliver the baby, normally has to do with two major causes or two reasons. One, your placenta. The placenta is the part, that tissue that supplies the baby nutrients. It's not well positioned in the womb. And one we call placenta previa. Here, the placenta is located right near the mouth of the womb, or the cervix area where the baby is going to pass to come out. So obviously that is a problem. The baby can't pass out. Yeah. And when you begin to go into labor, that place starts bleeding. So here you are, your baby is stuck in and you are bleeding. That is a serious condition. Yeah. And so that one, we need to do often surgery if the situation is very bad. Okay. The second one, the placenta of the baby, which is supplying the baby nutrients, is beginning to separate, is tearing out or being detached from the mother's womb. So obviously the baby is not going to be able to get nutrients, oxygen. So the baby is going to die. Whilst you, the mother, you continue to bleed. So these two are very, very serious complications. And any woman who sees bleeding before childbirth must rush to the hospital. This is not the time to sit on it. You and your baby's life are at stake. So you have to quickly go to the hospital. So this is important.
So ladies and gentlemen, it means that if you are pregnant, it doesn't matter the age of the pregnancy. We have been told that there is bleeding that can happen early during pregnancy. There is bleeding that can happen towards the end of pregnancy, but be it as it may, once you find that you are bleeding whilst you are still pregnant, please rush to the hospital, because you may not know what is happening. But if you get to the hospital, then the doctors will know, and they will know exactly what to do for you. It is very, very, very important. I hope you are taking note of that. Yo, doctor. And there, you may already offer the obi onyinsana moja routine. Say ebia oba afen yefru ana. Ese so hu se moja ba na. So hu so a edan ena ma moja no eba bra onya enwoye.
Sani amika ya no unyinsa moja betimi atu bra nyinsane fiase no ye mfa ne se anase ninsane enko nanim no be wanya busumi ba ko ekọ busumi num busumi nsia ho no samre num se u start se wo hu se wo moja tu dia and then e kire se ninsane pese ese enu no e was se odi kan ekọ hospital moja no betimi atua kopim said ninsane baby no be fimu abenu ye kan se miscarriage abrofo no kan se miscarriage be hospital no mo fi abortion. But no fa ye wo moja tu nipa anasa pim for bra ninsane yedi kwetire du be busumi nkron ho no busumi nson ekọ busumi nwotwe busumi nkron ho no sa moja to no so eno so niema ne ba no different anamin kan say different akwara ne chirade na ebia wan tire awodie no mu yie ana ba bia tire awodie no mu no enye ebi wo ho na ba tire awodie na anu ba bia baby no be fa pie no nti se koba no sa wo se na moja 2 na na akwara nso asa ka awodie no mu ontimi pie nti ehia se doctors no ebeye hu bibi bebre no ebehia se ebeye operation. Obi ohonso ana ekrade na start YY. Bra and time I was say why. I was say oba no wo chire baby na apia wie no ansa na ne krade no awaya free awode no nti say ekoba no say baby no da so hyemu na sa awode no krade no yidia and the na kire say baby no obewo anu nti enu kire say wo say awode ka hospital nti emfa ho wonyin say na say wo hu moja bia de wo say awode hospital ma doctor for no hwe nia ma sa moja to no as chase.
Ladies and gentlemen, or say wonyem na se mention say wo bewo na wo hu moja say wo tumrika Eco Hospital. Let's go for a short break. Welcome back. So, ladies and gentlemen, this is the online pregnancy school. My name is Dr. Linda Vanotu, and today my guest is an obstetrician, gynecologist, a consultant. Her name is Dr. Sylvia Diganus. We are talking about bleeding during pregnancy, and we have gone through what is called the antepartum. She has told us that before somebody goes into labor to deliver, the woman can see blood, and it depends on whether it is early or late and the causes she has told us. But one thing is certain, that if you are pregnant and you see blood at any time, it is not a good sign. So please rush to the hospital. We want to remind ourselves that this program is proudly sponsored by Promise Ghana, Vanotu International, Reverse Tap. If you're having any party, please remember to invite them. So take their number and call them. You'll be amazed. Reverse Tap, Samsara Ventures. We are still in the COVID season, and therefore we need to maintain our hand washing practices. Use Samsara Ventures Bubble Gold Liquid Soap, and you'll be happy you did. The program is also sponsored by Erama Clinic. They are into a lot of aspects of health. They even have a pharmacy. So if you are looking for a good place to go for public health and clinical care, please choose Erama Clinic. We're going to move on with our conversation, and we are going to move to another side of bleeding in pregnant women, and that is after the woman has delivered. Doc, now we have heard about the early bleeding and the antepartum hemorrhage. We are moving on now to postpartum hemorrhage. What is postpartum hemorrhage?
Postpartum hemorrhage, just to put it simply, is bleeding after childbirth or bleeding after the baby has been born. And this is a very serious condition, I must ask, that it's the leading, when I say the leading cause, is the one cause of death that many women in our country and in our region die from. If you want to look at the things that kill women, is the number one that kills women. So it's a very serious problem. Bleeding after the baby has been born. Postpartum. Partum is childbirth. So postpartum hemorrhage. Hemorrhage is bleeding. Simple.
Now, you said after the woman has delivered. When a woman delivers, she bleeds, right? All women, when they deliver, I believe they bleed a little after delivery. So why is this an issue?
Normally, when the baby has come out of the womb has to shrink, or what we say contract. It shrinks. The womb is like a balloon. When the baby is in, as the baby is growing, it also gets very big, much bigger. But as soon as the baby comes out, this womb shrinks into a tight ball. And in shrinking, it cuts off the blood that is flowing through the womb to the baby, because the baby is out. And normally every woman will bleed a little bit, just let's say a handful of blood just because the placenta of the baby is separating. So that is normal. But when we are talking, what we are talking about is excessive bleeding. Bleeding that is so much, almost, let's say the small bottle, the 500 liter mils bottle of water.
Yeah.
About that amount of blood is, and then it's not stopping too. So it continues, and it will continue until almost the woman has lost almost all her blood. So that is a very serious situation. So medically, we say bleeding more than 500 mils. Okay. 500 mils is a small bottle of water.
Or a sachet of water.
Yes, about a sachet of water.
Okay.
So that is serious. But you see, it's not just the quantity alone. Some people don't have blood. They are anemic. Okay. So for those people, they don't even need to lose 500 mils. Right. Any small amount can tip them over into crisis because already their blood level is very low. Okay. Especially women who have anemia during their pregnancy. So that's why I'm not emphasizing the quantity too much, but the quantity is also important. Okay. That is excessive blood loss, excessive beyond what we think is acceptable. Oh.
Amafo, nde zaye ka ho asam no onye de besia onyinsan wakowo na mmoja etun. Ona ye pede ye tase des wakade obi awo mmoja etun a oya dodo ya yemhyehye a na okyeredan. Ntim jizden na doctor wakan brofo na obekan twi su kakra kire no sende nkofo pii na wakade wopede wotsi twi no nti na nansen ye de brofo na twi no ye de bom na ye de ba no. Enti doctor mesrew sese no sende wesi a kire ye no wosi so obi kwo wo wie na se moja tu na oba bia wo wie a moja kakra eba na ada na bi wo honum a eno no ya na aya yemhyehye ama hospital for no I say ya yemhyehye nso ma maame na onyem ene ne busuafo no.
Auntie Linda say na okaye no oba bia wo ana se baby ne pue wie a moja kakra bi afri no ho eba na ne eka no na kire se moja eba edie ede ebruso edosu yie na entwa so ekusu eku oba no. Okay. Seba kusadi a endie wo nkwa na da unam wo nkwan so yi se etimi eyade ekoma pa se ye hwe ema ewo wiase mu a duduo na afimoja to ya ye kan nti enya de kitu akra eyade serious e wo se wo kan se hwe ba bia wo de yi ehye ewo yem na se moja afi ho badia ye bede ye den aso ano ebe de astopisa moja to no nti enya adikitu a adikese bia otimi within 1 hour kwa no 1 hour wonru 1 hour bebre anu 1 hour no omaka baby nti hia se be ye ho adwuma ntem wotwitwu nan a oba no ebe fi onsam.
Wow.
Amafo nde zaye ka ho asam no onye de besia onyinsan wakowo na mmoja etun. Ona ye pede ye tase des wakade obi awo mmoja etun a oya dodo ya yemhyehye a na okyeredan. Ntim jizden na doctor wakan brofo na obekan twi su kakra kire no sende nkofo pii na wakade wopede wotsi twi no nti na nansen ye de brofo na twi no ye de bom na ye de ba no. Enti doctor mesrew sese no sende wesi a kire ye no wosi so obi kwo wo wie na se moja tu na oba bia wo wie a moja kakra eba na ada na bi wo honum a eno no ya na aya yemhyehye ama hospital for no I say ya yemhyehye nso ma maame na onyem ene ne busuafo no.
Serious.
It is very, very serious. Please, are there types of PPH? We have types.
We have different types. Yetimi chichemu say yetimi chire niema ema meba. Yamana manu bano. First, you better not actually obi go for all be a baby no free no pet namojana as that is say tuno. And no answer a child and no crab a yana say where ye child and you namojana as starting within 1 hour of delivery. Baby not free or within the first 1 hour no namojano as started. And I said that first day no. And I 1 year, what after 24 hours, Bibia, you were now cook your crampo. Then we train Namoja started say to you, and your friend is secondary PPH.
Okay.
And after 24 hours, no. Now say Mojano started say 2 hours, can say, and a late secondary PPH. Primary one year near Sadana, Mojana started say film and your friend of primary PPH. Into yetimi say chichemua primary and secondary. Your also yetimi trenia ama mojatono ebano and also yetimi use different classifications. Let me say main cause on church one because that also.
Before we continue, what are the causes of the primary PPH and what are the causes of the secondary PPH?
Okay, primary PPH no. Normally no, you want nyama 4 ema moja etu ema after baby naba no. Ya di kan say na me di kan kire no. Awudia no eti say balloon. Nti baby ni nye free mu pe na amoa a shrinky aye kitwa bi. Yes, no etwa moja ebeba akwara no ho nti stop bleeding no.
Okay.
Nti say ko ba no say sa shrinking no ana say na awudia no be moa na amaso no. Na awudia na ye bete na ye flabby. Bete bi ti na moja every ho by your friend etony.
Okay.
Awudia entimin contract ye. Enu adia edi kan pa edi sa moja to no eba. A tonic uterus no. 70% so onya ema moja to omo 7 out of 10 no na yesa etoni no na edi ba. Ye to su mienu minka ne say test ana say banana why sitting I wouldn't cry Casanti pie. Inti say a hoti, I wouldn't know tea, and I say one nine more quine hop, baby tina say tick a cidia. Baby a tea and Moja betty me a free wabba, and we need test no.
Okay.
Yet us yes, son, a chadian. Obi Owana a chadian aka, Nayasi. Baby never you yantimi ye chadian if you and I say ye no. A who be aka, I would no. Say Cobano sa Emma would no quine and to me and contract ye into a bema moja air 2 obanos and me a dear tosu yensa. Yet also 9 Effie Mojayari. Obi Owa, Bibitina, unto me and for me cloth. I best stop it bleeding. Into a nune idea at also 9. Ya cannot be a very important. I would dare to me investing in him, but at 9 where I'm a cano. Omuni Niema Emma Moja etimitu a attitude. First one, send a macano. 7 out of 10 na ye awudia entimi emu aye and stop it bleeding. No send a make your friend etony.
Wow.
Yes.
Wow.
Second one no. This is secondary one no. Secondary one be brain na ye aproprobi and I say infection bi akọ womb no ho. Instead na normally no ba be kofie wie be na miensan na otwe akire na moja na astate etu no na ekire say germs akọ awode no infection akomu enu na ema sa moja to no eba.
Okay. Wow.
And access thought that be a ni pakron operation. Nze be 1 week akire na ahoma na astate say sunny.
Yeah.
Say, Ebiana infection come, baby, I operation now, humana status as sunny or dear.
Ladies and gentlemen, let's go for a short break. Welcome back. I believe today you are learning a lot. This is the online pregnancy school. Today we are talking about bleeding, and we are focusing on postpartum hemorrhage or bleeding after a woman has delivered. My guest is an obstetrician, gynecologist, consultant, Dr. Sylvia Diganus, and she has given us some of the causes of bleeding. Watch hen bebre amanfo nti no ya na ye pede nkofo wo ko hospital da ma semi se enti ya na se wo fie mojeru to ebodwenda onyinsa ne di ode moja kakraba oso ntedam ena sanko bebi so ekokko wa wonyim ade ode woye mawa se moja ni rutu obeka do ye kitikiti bi nso e bi ya na ketekete no osi within 1 hour obetumu amamami a wenyinsa no wa wi wa hwere no nkwa onye dam na ye pen nti na ye pede obi biara etse them pregnancy schooling nti mpocho invite a friend, invite a sister, invite a brother, invite anybody, and remember to visit my Facebook page and YouTube channels. My name is Dr. Linda Vanutu, and listen to the previous episodes. She has talked about anemia. It's strange na ye wedi bembe bre a ye betumi yedi na wa mehena ahonzen nso oye wo de self mbesi afo 10 a wonyinsa na betumi enye baby po a no mu be ye 3 4 na wa ya anemic o chede honim boja no owo fom obi dem na osese owo na moja kiti po no otunu po a ahwe ya na wa ka ye haw obe ya tete de benyinsan na ebowo na moja etuma efim ye mpenedam. Doc, please, you mentioned atony, and you said that it's about 70% of the time that we have atony leading to PPH. What causes this atony?
What causes atony? It's a lot. We can have atony. In fact, let me just say that PPH is very difficult to predict. You can't tell who is going to get PPH.
I was going to ask
that. Bleed after childbirth. It's very, very difficult to look at a woman's face and say, you get PPH. But we know that there are certain situations that make PPH more common. And I'll mention some of them. One, for example, is that we know women who have twin pregnancies.
Okay.
Because the womb has been stretched and is bigger, they are more likely to bleed more. So anything that stretches the womb and makes it a lot bigger causes PPH. So the twin is one example. A very big baby is another example.
Yeah.
And then there are situations where the fluid around the baby is a lot. So the womb is very, very stretched. So twin or more, anything that stretches the womb.
Okay.
Anything that makes the womb tired. So if a woman has been in labor for hours and hours and hours on end, and the womb is fatigued. So by the time the baby comes, the womb has lost all the energy and cannot even contract anymore.
Wow.
So for women who go and sit and labor for 2-3 days before they even decide to go to the hospital, they are more likely to get PPH. Another reason why women get PPH, we know that women who have had a lot of pregnancies, especially, they are more likely because they've stretched the womb a number of times. Their womb is not as young and as strong as the woman who has had 1 or 2 children. So the more children you have, the more you have the chance you have of getting PPH. So that one is another one. Then the women who have the placenta in the wrong place. Remember, I was talking about women who are bleeding before childbirth. In fact, we have a common saying that the bleeding before you deliver weakens you, and the bleeding after the childbirth kills you.
Wow.
So if you start bleeding before you deliver the baby, the chance is that things are going to get from bad to worse after you deliver the baby. So the placenta problems, the woman whose placenta has separated early before she delivers, the woman whose placenta is not well situated in the womb, like I said, around the mouth of the womb. That part of the womb doesn't contract very well, doesn't shrink too well.
Okay.
So it's like the doorway to the womb. It has no contraction. So if you have any of those, you are likely to bleed. We also know that women who have anemia, their wombs don't contract well because it just doesn't have the oxygen carrying capacity. You know, myoglobin is the cousin of hemoglobin. I'm just using the technical terms. That the wombs don't have, they are not able to get enough oxygen to contract. So if you're anemic, you are also likely to have a problem where your womb cannot contract well. So we are looking at so many different reasons why women bleed. Another one I just want to add is that women who have operation are more likely to bleed. You bleed more when you've had an operation than when you've not had an operation. So women who have cesarean section, they lose more blood than the women who deliver naturally. So these are some of the risk, we say risk conditions for PPH. There are many. I hope I've mentioned the most important.
This is the online pregnancy school. Today we are talking about bleeding, and we are focusing on postpartum hemorrhage or bleeding after a woman has delivered. My guest is an obstetrician, gynecologist, consultant, Dr. Sylvia Diganus, and she has given us some of the causes of bleeding. Watch her hen bebre. Amanfo, inti no ya na ye pede nkofo wo hospital. Damasemi se enti ya na se wo fie mojeri to ebodwinde onyinsa ne di ode moja kakraba. Oso ntedam. Ena sanko baby hwe ekokko wo a wonyim ade ode wo ye mawa. Se moja ni rutu obeka do ye kitikiti bi. Nso e bi ana ketekete no, osi within 1 hour. Obetumu amamami a wonyinsa no wa wi wa hwe no nkwa. Onye dam na ye pen. Inti na ye pede obi biara ete them pregnancy schooling. Inti mpocho, invite a friend, invite a sister, invite a brother, invite anybody. And remember to visit my Facebook page and YouTube channels. My name is Dr. Linda Vanutu, and listen to the previous episodes. She has talked about anemia. It's strange na ye wedi bembe bre a ye betumi edi na wa mehena ahonzen. Nso oye wo de self embesi afo 10 a wonyinsa na betumi enye baby po a no mu be 3, 4 na wa ya anemic o chede honim boja no owo fom obi dem no se so wo na moja kiti po no otu nipo a ahwe ya na waka ye haw obeya tete de benyinsan na ebowo na moja etuma efim yempe ne dam. Ladies and gentlemen, with all that doctor has listed for us, you can understand why it is important to take the antenatal seriously and also go to a health facility with trained staff for delivery. Bebre na waka oside obi a ne ba no sondodo obi a onyinsan ebia wo yentafo anantansa bibiara obama awode no numu atwe no oya nhweye ya na ewuwi a nature no ntum omwaye ntebonde na moje botumetu bebre na waka. We don't want you to suffer bleeding and die after delivery. That is why we encourage you to use the health facilities when you are pregnant and when you are also going to deliver. It is very, very, very important that you do that. It's very important. Doc, with all that we have said, is there any treatment for PPH?
Oh, yes. In fact, as far as the medical, we start you by preventing the PPH. So even the iron and the folic acid we give you during the time you are pregnant is to prepare you for childbirth, because we know that if you are anemic and you bleed a little bit, there is disaster. Yeah. So we start off by making sure that all our women will enter labor and delivery with a lot of blood. The blood levels will be good. And we do that by giving you iron and folic, which enables the body to produce a lot of blood and make sure that you are as healthy as you can before you get into delivery. So even if you bleed a little bit, your system can withstand it. So it is important for women to make sure they treat anemia before they get into the time of delivery. So women, please take your iron and folic. It's no joke. You have to take it. Now, when you get to the time of childbirth, we have an injection we give you just after the baby has been born. We normally will put it into the thigh. And the purpose of this injection is to help the womb to shrink tightly so that you can remove the placenta and there will be very little blood pouring. Okay. And so this is one of the most effective ways of preventing women from bleeding, by giving that injection, which we call oxytocin. Okay. For women who do not deliver in hospital, there's a tablet that they can still take at home. I'm not saying go and deliver at home, but if situation happens and you have to deliver at home, there is a tablet called misoprostol, which you can also take orally in your mouth, and it will help the womb to contract and shrink tightly so you don't lose too much blood. Now, these are the two ways we prevent bleeding from progressing, but we are human and situations happen. So there are situations where, in spite of these treatments, a woman will bleed. Like I said, PPH is not predictable. You can't tell who is going to get it. So it is good when it starts to have somebody who knows what to do. Yeah. And the things we do are many. If it starts, one of the first things we do is to try and, coerce the womb to contract by rubbing it. Okay. If that fails, we add more of the medicines that will help it to contract. Okay. If that fails, we are now going to force it by applying pressure with our hands to contract. In the meantime, whilst we are doing that, we know you are still bleeding, so we have to put up a drip for you, put the medicines in the drip. We have to get you a lot of blood because we know the blood is flowing down there. Yeah. And so that's why we tell women that all women, before you come to deliver, If you can help us get some blood in the blood bank for you, it helps. So there are hospitals who insist that every woman must donate at least 1 unit of blood. And please, when a woman is bleeding, 1 unit is not enough. We have to give 4, 5, 6, sometimes even as much as 10 to save that woman's life. So we need a lot of blood when women start bleeding after childbirth. It's not a small bleed. It's a very, very heavy bleed. So women and their families and communities must help us to have blood. So like I was saying, if we get to the point where all these things we are doing with our hands, with the medicines fail, we have some devices we can put in the womb. We call it a balloon. We blow a balloon in the womb. Uterine balloon tamponade. If that too doesn't work and the woman is pouring, you see I said pouring, it means the bleeding is like a torrential rainfall. If that goes on, then we have no choice but now go into the operating room, open her up. And when we open, we either try to tie the blood vessel which is bleeding, or if that fails, we remove the womb and save her life. But these are all things we have to do very quickly. Like I said, when bleeding starts, most women die within 1 hour. So if you don't reach the hospital quickly, or there is not quick action taken, the chance is that you will not make it. Wow. It's a very serious situation. So it's a lot of rapid action. Yes. Rapid action to try and arrest the situation.
Amafo, osede. Sebesia no osha sede mojerutu na oye American kutin na hospital from wotu. Osande within 1 hour, besia botu ma hwere no nkwa. Na obeye yew, obeye areho. De obi wawo ehunde mami wananso waba de ho wawo. Na wawe wie na osi moja no pouring. Oni chiro mosi moja no osi oba. Eye ne hwe ya hwe ye onyeye. Nti wobo modin woba manedu, wobo modin da wodin sabe hye wobo modin da wodin da mabi be ka ho wobeye ne nyina na eye kro no wanyeye na ede kro no tuado. Oye bibia otwatuado tantantantantantam da mobeye ma wobetum waje maami nkwa. Na ha na mepeda mesra manfo, I would like to make a plea. You know, sometimes when people go to the hospital and they are asked to donate blood, they don't understand. Because of that, some of them even refuse to go for the antenatal or even go to deliver in the hospital. Obinu wakacha mwende na mami, hwishobi nomba chumoja ekor ofensi wa, onem de minti osami, mumbuare po munkonko wa hospital. Obisho owu wios ne mummoja na mede ben mreba beji madi. Sebe wache hende. Se moja ruto obi pa na wode Amerika wo pede woje no nkwa. Onye moja bodambo kor na wode je no nkwa. Obi woman 6, obi 7. Na sa awo ene hia moja na wo mo 1 pa. Ebeka de krope na mezibenti wonje ya. Would you be happy to be given 1 pint of blood when you need 6 because you donated 1? Would like to use this opportunity to ask anybody, the husbands, men, people who believe that they can donate blood, to go to the hospital and say that I have heard that women when they deliver can bleed to death and I want to help to prevent that. Therefore, I'm coming to check if it is possible for me to donate a pint of blood. Mesrao, se woho eriti damasemi ayeri came. So ya sure, so you could be, whichever group you are in. Talk to the people within the group. Arrange. Go to the nearest health facility and tell them that you have heard that women, when they deliver, can bleed to death. And you want to help to prevent that. So they should check if it's okay for you to donate blood. If it is not okay, they will not take your blood because they will not let you also suffer for donating blood. Mr. One. The other thing is that she's talked about the folic acid and the iron tablets. Ladies and gentlemen, what some people do is that they refuse to take these tablets. mbesiafo bi ho a won fedru no o send was wofa baby ni be ye kese o ye kese a ontum na nankasa onkyem no wunti oremfa nti ne bonde ni mogya no obofom dam no mogya kitikiti bi potu na wa ya tete. We don't want that. Pregnancy should end in joy. Pregnancy should end in joy. My guest is Dr. Sylvia Diganus. She's a consultant obstetrician gynecologist. This is the online pregnancy school, and my name is Dr. Linda Vanutu. Today we are talking about bleeding in pregnancy, and we are zooming in on postpartum hemorrhage or bleeding after delivery because it is a major cause of death in pregnancy, or what we call maternal mortality. Doctor, now you have told us a lot about these things, and initially I wanted to ask about the contribution to maternal mortality, but you said that it is quite huge, and you've also told us about the prevention measures that are being put in place to ensure that these women survive. Is there anything else you would like the pregnant woman and the family to know about postpartum hemorrhage?
I think what I want them to know is that postpartum hemorrhage, you cannot predict it. You can never predict who is going to get it. We've mentioned the people who have a higher chance of getting it, but it's not everyone who has a chance who gets it. So first of all, you must make sure that when you are pregnant, you are well nourished, your blood levels are good. You've said all this, but more importantly, who is going to handle your delivery? You must make that decision well before the time of delivery. Make sure that you deliver with somebody who knows what to do when PPH starts. Make sure that you have blood in the blood bank, and make sure that even if wherever you are delivering, when PPH starts, you do not waste time, and that you can reach a hospital where there is blood, where there is a theater to operate you, because at that point, those are the things you need. Unfortunately, some women, when they are referred because they will have PPH, or the chance of them having PPH is high, they end up in other places. One of the reasons where people have PPH, and let me just mention it before I forget, is when women have hypertension in pregnancy, the preeclampsia. I forgot to mention it. It also increases your chance of getting PPH. So these women are told they have a problem. You have twins, please deliver in hospital, and they say no. We'll deliver maybe at the health at home or in a church. Our women are delivering in church these days. When PPH starts, instead of getting quickly to the hospital, they will be trying to remove evil spirits. You can be praying for the woman while she reaches her help. Many women get to the hospital a bit too late when things are bad. And at that point, it's very, very difficult to save their lives. So I'm appealing to the women and their families. It is not a joke. We are not joking. Prepare for your childbirth. Take your iron. Make sure you deliver somewhere where if PPH starts, you can get all the help that you need. I think that is all I have to say. And Auntie Linda.
You have said it all. You know, ladies and gentlemen, we have discussed PIH or eclampsia before. And as Dr. Diganus said, the placenta can remove from where it is placed. And if your blood pressure goes up whilst you are pregnant, then that can happen. She's also mentioned a very important aspect, which is key to women's survival, where they go to deliver. Unfortunately, some women, their blood pressures are high, They don't know where the placenta is, but they still go to these prayer camps and the rest. We are Christians. And before surgery is done, we pray that, Father, help us, because we are human. Unfortunately, some people keep these women till they even start fitting, because the blood pressure is very high. And as they fit, they still think that is the evil spirit. Then on top of that, the placenta detaches, then they start bleeding. So they are fitting and they are bleeding. Even just one of them can lead to the woman's death. Imagine both happening at the same time. So the baby dies and the mother also dies. Unfortunately, they send them to the hospital very late. Please, yepede papafo inuanom obia otidamasemi. Se obi nyinsana. Sebe betuma bompay. Nso fa no ko hospital so send na hospital for no we sua ma oda waye. Na obi wo ho a wo na akọ to baby wo se yere bompay aman. Ebia na ne BP no wo so nti na wa hya ase de orihim ti de obi a otwa. Ade orihim no won fa no ko hospital wo se hey sunsun finu na ore yedam. Ono na echi no moja hya ase de oritu no so a no so ya asam fofor. Yesra hon. Obi nyinsa na and to their husbands, please take interest in the woman's antenatal care. We have said this several times. When she comes home, ask questions. This is a forum that you can use to understand more about pregnancy. If you have any question, don't hesitate to send us a WhatsApp message on 059 242-0625 059-242-0625, and we'll be very happy to answer the question for you. And also go back to our previous conversations and listen. If you have any question on any of them, don't hesitate at all. Just send us messages and we'll be very happy to answer them. Today, our topic was bleeding in pregnancy, and we focused more on postpartum hemorrhage or bleeding after delivery, because it is a major cause of death in pregnant women. My guest is Dr. Sylvia Diganus, an obstetrician gynecologist. You know what that means, right? You know what that means. They are there to help pregnant women. You have a lot of people who are interested in you, in making sure that your pregnancy goes on successfully and you have a live baby whilst you also stay healthy. Let's go for a short break. Welcome back. Doc, I know you have said a lot. We are now signing off. Is there a last minute word that you have for somebody out there?
I just want to also add that even after women have survived bleeding after childbirth, there is still a lot of difficulty they face. And we must also remember that many, even if you don't die, many are left with anemia. Some get damage, long-term damage because of the shock that they went through. Some get depression. They are not able to work. It's a big trauma for women. Mm-hmm. So if a woman has survived bleeding after childbirth, it's only one step in the long journey to recovery. There's a long way to recovery for many women. So the effects are long-term. Many survive, but with a lot of problems. Some can't even breastfeed anymore because of the damage that happened to their brain from the anemia that happened, when they could not get blood in their system. So there are lots of complications that we have thought of.
The kidneys women affected as well, right?
Pardon?
The kidneys can be affected as well. Her kidneys.
Kidney failure,
yes.
Kidney damage problems. And so it's not good. We must prevent bleeding after childbirth at all costs. It should not happen. And so I'm begging all women, take care of yourselves. Make sure you receive the best possible care. Make sure you enter labor very healthy. Don't forget to take your iron and folate tablets. A lot of women don't take it, and they take other things that don't help. Talk to your doctors, talk to your midwives about the problems. They are there to help you. So all the best to women.
All the best to women. From the treatment description that she gave us, the last resort is that the uterus or the womb will be removed. You don't want to have that. Once it's removed, it is gone. And if you are not fortunate and this is your first pregnancy and this child also does not survive, then it means that you will not be able to become pregnant again. And she has just told us that even after that, if you survive, there are so many things that can happen. What kidney betuma say? Wadwunem betuma bibi fofor. Ebo wieno so na aroho kese na washaw. All these things, if you deliver in a hospital or where we have a trained person, then they can pick some of these things early and give you the necessary help. Remember, she says that yentu muhude mami A owa obe bleed ana B no wo be bleed. Owe no na shasi. So please take note. I hope you have enjoyed today's program. Doc, I want to say a very big thank you to you. You have told us a lot. Yes, you have shared a lot with us. And you see, I could just see the passion in you because this is something that you've been working very hard to prevent deaths from postpartum hemorrhage. You have done so much, not just in Ghana, beyond the borders of Ghana. She's been working on postpartum hemorrhage, and there's so much that she has done, which you will see. And from the way she spoke, you know that she's passionate and she's praying and begging you that don't let this happen to you as a pregnant woman, to your sister, or to your wife. So please take note. This has been the online pregnancy school, and we have been discussing bleeding in pregnancy. Dr. Sylvia Diganus is a consultant obstetrician gynecologist, and she has told us a lot. My name is Dr. Linda Vanutu, and I hope you have learned a lot. Please remember to visit my Facebook page at Dr. Linda Vanutu and go through what we have discussed previously. Also, visit my YouTube channel, SHIC Ghana TV, and subscribe to it, share with friends so that you'll be informed whenever we have a program coming up. Enjoy the rest of the day. Bye.
Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanutu on Facebook and YouTube every Saturday at 4 p.m. on the online pregnancy school as she discusses pregnancy, delivery, and childcare.